the fracture simulation mini-arm, stockinette, orthopedic padding, a roll of plaster of Paris, a pair of scissors, a protective work surface cover, gloves, a disposable apron, as well as a suitably sized bowl filled with water at room temperature or somewhat lukewarm, and an assistant. Warning: do not practice this project on a volunteer person, as the kit does not contain the required equipment for removing splints. Follow these steps. Gather all the required items. The arm must be clean and dry before starting the procedure. Don clean gloves, put on the protective disposable apron, and open the protective work surface cover. Remove the outer paper of the plaster rolls. Cover the arm with stockinette. Ask the assistant to hold and stabilize the arm with the fracture in a reduced position. Gently roll 2 layers of orthopedic padding over the stockinette for protection. Don't apply the padding too tightly. Soak the roll of plaster in the bowl of water and allow most of the air bubbles to escape. Then gently squeeze to remove excess water. Unroll the plaster over the protective padding. Mold the plaster splint according to the anatomical form of the limb. Roll back the edge of the stockinette to ensure that the hard side edges of the cast are covered by the soft stockinette to minimize abrasive action of the cast on the adjacent skin. Use water to assist in the molding process and to smooth the surface of the cast. Allow the plaster to set. It takes about 20 to 30 minutes, depending on the temperature of the water used. Warmer water will accelerate the setting time. In a clinical setting, the attending medical professional will now give both oral and written instructions regarding follow-up dates, anticipated time for removal of the cast, instructions regarding restriction of activity and mobility, care for the extremity, care for the cast, and avoiding excess water on the cast. Once the cast is set and dry, you may ask all the members of the team to sign their names on the cast. To retrieve the mini